patella, good. What else? Femur, good. Tibia, good. Anything else? Not in the actual knee joint, but you do have something nearby that you want to palpate. Fibula, good. So patella is usually pretty easy. You can find it on most people. You want to palpate all the borders of it. It's like the superior, the medial, and the lateral, and then the apex, the peak, the pointy part. So you want to palpate all the borders of it, and then the middle of it as well. Okay. Femur is pretty easy. Everybody knows where their femur is. I think I've told you guys this before with these big long bones. It's really hard to get down and actually palpate the bone. So if you just kind of do like a shear like this on the femur, then you can kind of rule out like any sort of fractures or anything in the femur. And then tibia and fibula we just did. With the tibia, you want to make sure that you get sort of the plateau, so the top part of the tibia. You want to make sure you palpate the tibial tuberosity. So it's a little bit more of a bony part. That's where your patellar tendon attaches. And then pes anserine. Does everyone remember what pes anserine is?
It's on the medial side of the...
Yeah. So if you find the tibial tuberosity, it's just medial from it. And oftentimes it'll be like you'll be touching hard bone, and then it's a little bit juicier there. Because what attaches there? Sartorius?
Say grades before T. Gracilis, tetrafasciolata, or no, say grades before T.
So say is S. Sartorius, gracilis, semitendinosus. So your medial hamstring. That all attaches onto your pes anserine. Good. And then for bones as well, you can bend the knee. You can feel the epicondyles, or actually, sorry, the condyles. So the condyles, remember the knee is a hinge joint, so it has to be open like this to feel the condyles of the femur. So you have your medial and your lateral condyle. They're on either side of the patella. The patella kind of sits in between the two condyles. And then epicondyles are a little bit higher up. They're like the bony parts that stick out the side of your femur. So here and here, medial and lateral epicondyle.
So the condyles are just inferior to the epicondyle? Coming down? Okay.
So the condyles are like this part of the knee.
Oh, okay.
Right? The part that sits in with the tibia. These are your condyles. Epicondyles are on the femur. And you can palpate them no matter what. It's easier when they're bent, I find, when they go like this and all their soft tissue kind of covers them. You can still palpate them, especially on Beth, but easier like this. The condyles you can only palpate with their knee bent. Does that make sense? Okay, I think that's basically it for bones. Don't forget about the head of the fibula. It's not really part of the actual knee joint, but it is its own joint with the tibia, the tib-fib joint. So you can palpate that. Articular, what do we have in the knee? MCL, PCL, LCL, ACL, meniscus. Good. So those are your major things. And then patellar tendon is another one too. You can do it with either with articular or muscular. It doesn't really matter. It's kind of part of the joint, but it's also technically a muscle, so it doesn't matter which one you palpate it with. How are we going to palpate ACL and PCL? You can't, right? Because they're deep in the joint, so we don't have to do those for palpation. But we are going to do MCL and LCL. They're pretty easy. MCL is on the medial side from your femur to your tibia. So you just palpate along the medial side of the knee. And then LCL, same thing, lateral side from femur to fibula, head of the fibula. Palpate along the lateral knee. Good. Meniscus, again, you need their knee bent. And if you find the kind of the plateau, you'll see there's like a little bit of a gap there in between the femur and the tibia. That is where the meniscus is. And there's both medial and lateral. So feeling in that gap, you're basically palpating the meniscus. Okay, so that's medial meniscus, lateral meniscus, and then patellar tendon. Super easy. Find the apex of the patella, find your tibial tuberosity, it's right in between. And you'll feel how, like right here, there's sort of a gap, and then I get to her patellar tendon, and there's no more gap, because that's where her patellar tendon sits. Here, there's a gap. Okay, so that spot in there is her patellar tendon. Okay. Everybody's good with that? Okay, what muscles do we have in the knee?
Quadriceps,
Good. Quads. What 4 muscles make up the quads?
rectus femoris,
Yeah.
quadratus lateralis, medialis, and intermedius.
Vastus
Sorry,
lateralis.
vastus.
Vastus lateralis, vastus medialis, vastus intermedius. Good, so you can palpate all those. Remember, rectus femoris comes all the way up to the ASIS, and it touches on the ASIS, so you can start there and just work your way down. Sorry, I know it's tender. Work your way down, and then it becomes the patellar tendon. Vastus lateralis is more on the lateral side. So you'd start on the lateral side. And then vastus medialis on the medial side. Good. You can also palpate the adductor group because they do cross over the knee. So that's just all along here, the inner thigh. Hers are pretty tight. Along the inside of the thigh. Good. What else would you want to palpate with muscles?
The hamstrings.
Hamstrings, good. I'll do this in a second, so I'll get her flip over. What else? IT band, good. Anything else? What about the popliteus? Everyone remember that little muscle at the back of the knee? So we'll do that one in a second too. So IT band for sure. IT band comes from your glutes and your TFL and your hip, and then just runs along the lateral side of your thigh. So hers gets a little bit tighter near the bottom, and then it almost becomes rope-like, and then attaches. It's called Gerdy's tubercle, which is on the lateral side of your tibia. So pes anserin's on the medial side. Gerdy's tubercle, where your IT band attaches, is on the lateral side. Okay, good. If you want to flip over, we'll do the back. So in the back we have hamstrings. What 3 muscles make up the hamstrings?
Biceps femoris.
Good,
Semitendinous. And then
good. So biceps femoris is your lateral hamstring. Remember, hamstrings originate on your ischial tuberosity, so you can start all the way up there, palpate in there, and then for biceps femoris, I'd work sort of down and across the lateral hamstring. And always make sure you feel the tendons. You want to make sure that you can feel 3 tendons. So you'd have the tendon on the lateral side, and it comes and attaches below the knee. That would be your biceps femoris. Then semimem and semitend are hard to differentiate between the two, so we just kind of group them together and feel them along the medial side. And then one tendon, so semimembranosus, is going to come and attach just on the posterior tibia. Semitendinosus is going to come and wrap around. So try to differentiate, make sure that there's 2 tendons present at the back of the knee. Sometimes people can tear one and you don't even really realize it because the other one's compensating for it. And then a week later you go in and palpate and you realize that there's only 1 tendon there instead of 2. So make sure you got 2 on the medial side, 1 on the lateral side. And then popliteus, if you get their knee slightly bent, so just relax your leg, good. And then basically feel the back of the knee. You have to be careful with this. If you push too hard and you hold it, you could compress an artery supplying her lower leg. So just be gentle, but basically the whole entire back of the knee is where you'd find the popliteus. And then gastroc too, remember, acts on the knee, so we just did that one when we did ankle. But if you are assessing a knee, you can palpate the gastroc, especially the 2 tendons, the more proximal part of the gastroc, medial and lateral. Okay. Anything else? No? Okay. Everybody's good to move on to hip then? So